All right, you're still not wearing the right coat.
Well, just like people go on hunger strikes, I went on a white coat strike until my colleagues, called doctors, stop harming patients and own up to the fact that there is no bad eczema, ever, never was, and they're all addicted to corticosteroids, period. Recently, again, the NEA, the National Eczema Association, has hired 2 doctors to go on tape, Dr. Leo being one of them, I don't know who the other one is, to tell all about TSW, like they invented the term and they invented the problem. That is not a problem. It is a remedy. The problem is steroid addiction.
But I mean, if Dr. Leo's talking about that, then why in the next breath is he pushing Dupixent? I mean, isn't acknowledgement steroid withdrawal isn't a thing? I mean, how do you can't have it both?
Keep saying that it's just, and they're on the wrong drug away, and put them on a good drug, a new drug that will sell at 40. Getting a stipend for that, and I'm going on the circuit giving lectures as many doctors. And oh yeah, we did a study of several hundred people. There were 20 of us. We all got well taken care of for sacrificing our patients, and the drugs never worked well.
Well, we post these videos and we get comments, every single one. Well, what about this? Well, what about that? Well, what about this? Is some alternate therapy or some treatment for topical steroid addiction? And one of them the other day was Protopic. Well, how does Protopic work?
Well, Protopic is Cyclosporine, but it's 0.1%, very, very, very weak, and it's never been shown or demonstrated to do anything of any value at all. It's too weak. And the problem is that indeed it keeps popping up because the doctor doesn't know what else to do. When the steroid or the supersteroid doesn't work, then he adds Protopic or Elvidil, which is the same, cream form, et cetera, et cetera. Many things are used. You open up a can of worms when you ask me about that. There are many things in medicine that are used and fail, but they keep getting used. If it's not a big deal, they fall by the wayside ultimately, and people stop using them. With this, there are so many patients who were born with atopic dermatitis and had used steroids and became addicted. There's so many of them. And the critical nature, which I've tried to get across, and we have talked about this innumerable times, the cure is 3 to 5 years down the pike. That is an immense amount of time. And if you're stuck and suffering every day, 24/7 for 3 to 5 years, you get rather frustrated, you get very angry, and you switch back and forth. Keep looking for the magic answer. Well, I'm giving you my advice, and I'm going to be forceful now. It takes 3 to 5 years for cure. Just like a cast on a fractured leg, a femur, takes 12 weeks. A cold takes 3 to 5 days. Pneumonia takes 7 to 10 days. We know this from studying medicine. I have studied and cured over 7,500 patients now with support or with cyclosporine or just watching them, and they report to me. It takes 3 to 5 years, no matter what.
Well, as Ryan pointed out, this is obviously trending, topical steroid addiction and withdrawal. 600 million and counting views on social media, this channel, repostings of this work on TikTok, that sort of thing. But when you look at people going through topical steroid withdrawal, who call it topical steroid withdrawal on TikTok, you look at the comments and it's much love to you. Have you tried, cap therapy, for example? It's just a constant wave of suggestions, all of which just completely reject the protocol and the status quo or the therapies that you're espousing. You keep talking about going to the doctors. I'm talking about people that have the problem that still won't wake up to the fact that it's 3 to 5 years of doing nothing and maybe some cyclosporine. I'm preaching to the choir, but
no, I don't know what more we can do.
Well,
that's why we're reiterating this whole topic now again in our 30-second conversation. And we have to do it because there is always a new soul who comes on the YouTube and watches, and they come up with these same questions. We hear about leaky gut repeatedly. We hear about topical moisture withdrawal, moisturizer withdrawal. We hear about acupuncture. We hear about CAP therapy. And you had shown me something. Would you mind reading?
No, it's basically, CAP means cold atmospheric plasma therapy, and it's legal as a treatment in 3 countries: the UK, Thailand, and Singapore. And they have these clinics that do it. And we've done a little bit of research, and it has shown positive effect primarily in the treatment of chronic wounds, prevention of scarring, that sort of thing, burn victims, that sort of thing. Some in the topical steroid addicted community have glommed onto this as a potential treatment for topical steroid addiction. And there are some YouTubers and there are some TikTokers that are talking about their process in using CAP therapy. It's these little clinics, and I looked up some of the clinics. I looked them up on Yelp and the internet and all that. And specifically, the clinic in Thailand does not claim any potential benefit to cold atmospheric plasma therapy. The only people that I can ascribe or find are people that are actually doing it. There's one gentleman who talks about the cost for cold atmospheric plasma therapy. If you're on a budget, staying in a hotel with no hot water or no air conditioning, you can do it for about $2,000 a month, including your therapy. They're all saying, people that have done it say that it takes 6 months to show any benefit whatsoever. And they all say as well, well, what would it hurt? What's it going to hurt? What's the harm in trying?
Well, it's outlandish. Could you read what the science behind it is, written by who knows whom? You showed it to me this morning.
Here was the comment. The main goal of the treatment is to normalize the cell proliferation rate. With topical steroid withdrawal, the skin cell proliferation rate is very low, which is why it flakes so much and takes so long to heal. The treatment helps accelerate the skin cell proliferation rate, but it takes time for it to normalize and become stable, which is why you need at least 4 to 6 months of consistent treatment. Just 1 month at a time will not make much progress and will end up regressing in the long run.
Well, that's balderdash. That's scandalous comments. It's so unscientific. What are they talking about? Cell proliferation. What has happened in medicine in the last 15 years, everything is immunological also. Everything. And if you attach that word onto this disease or to this new therapy that I have, you got it made, because everything, and everybody knows, is, immunocompromised patients, immunotherapy, or, this has to be attacked. So they're saying there's cell proliferation. It's vasoconstriction, vasodilatation of blood vessels. That's the mechanism. It's got nothing to do with this.
Well, I dug into the literature a little bit, and one of the main mechanisms of cold atmospheric plasma therapy is the increased production of nitric oxide. Nitric oxide. Will you speak to that a little bit?
That's exactly what is in abundance. We did a study, a detailed, very scientific study about 20 years ago. We took patients who were actively in addiction, Red skin syndrome, and participating in withdrawal. We took another group of new eczema people who came to the office, had no therapy, and we took a third group who were cured 2 years down the pike, and I called them to participate, and they were so pleased with their cure that they participated. 3 groups. The actively TSA RSS patients, the active ones, had very high levels of nitric oxide. This was done very scientifically. All of the other 2 groups had none or 0 levels. The data was looked at. We did hundreds of patients. The data was looked at by the statistics department at UCLA. The paper was published, was accepted by my peers, and it showed that the mechanism of the redness is nitric oxide. Nitric oxide is very interesting. It is a chemical proliferated by the blood vessels to keep blood vessels open, and it's seen in coma patients, in accident patients, for fear. The body's fear is that blood will not flow to the brain, and that's where nitric oxide comes in. And it's exactly what we don't want happening in these steroid addicted people. We want to lower it. I know of no way of lowering that chemical.
Well, doesn't cyclosporine, isn't that one of the mechanisms of cyclosporine?
There's no data on that.
Okay.
Yeah, nothing. And it was very, an attempt at several drugs that have been used in derm for a long time. When I hit upon it, that it was safe and it worked like an absolute charm. And when I'm not selling anything, I don't have stock in the company, and there are about 10 companies that make this drug worldwide. It works like a charm. Absolutely, instantly, across the board, just like it takes 3 to 5 years for a cure, and maybe a little longer in some, and it works within 3 to 7 days by easing symptoms, and when they start Cyclosporine, and almost all the symptoms are gone, and they look clear of skin in about 2 to 3 weeks, and they stay clear. If I try to lower or taper the dose too soon, they flare. It takes 2 years on the drug, or maybe a little longer, and they're only cured after 3 to 5 years.
So that begs the question, why aren't we on cyclosporine? Why are we flying to Thailand?
Well, it is a big gun. You got to be monitored. You got to watch the kidneys. And if we can get away with simple therapy, like a sleeping pill or anti-itch pill, or throw you in the tub, or the patients are worried about a big gun, or there's an expense involved, but nothing like the new drugs, then fine. It's understandable. They want simpler therapy.
No, I'm talking about flying to Thailand and going on cap therapy versus cyclosporine.
Well, you can imagine who does that. Either they're magical people, they're very well-to-do people, they do not believe what we say, they have their own doctor, they know everything, and they know how to make a decision instantly. And you see in the comments I get, the words, the adjectives they use about what they read about cap therapy. It's miraculous, it's wonderful, it's magnificent. They don't say that about...
Well, so is leaky gut, right? So if you get rid of your leaky gut, topical steroid withdrawal symptoms just go away. I've read it 100 times.
Well, in defense of the patients, how would you like to suffer for 3 to 5 years? Every day, getting up and itching, every day oozing, every night not sleeping, every day burning, every day can't take a shower because the skin burns. You're desperate to find something that'll ease that complaint. They hate the doctors. They will not get any more advice. They're so tired of being led down the wrong road. They read about the new drugs. They see that they're somewhere between $40,000 and $80,000 a year, and their insurance might not cover it. Or it's new, and they're tired of trying new. Or they've tried it, or their friends tried it, and it didn't work, like Depixent. At least 600 to 700 times I've seen patients where it didn't work. And the new ones, there have been no papers about value.
Okay, all right, I'll play. So, yes, you're miserable, you're suicidal, you'll try anything. So you try cap therapy, you try a vegan diet, you try acupuncture, you're into it for 2 or 3 or 4 months, and there's no improvement. I get the notion of wanting to try something, but I also feel like after you've tried it and it's not been successful, it makes you even more depressed and more hopeless.
Well, of course.
That's why I go bananas when I see these comments that say, well, it doesn't hurt. Well, it does hurt, because you're giving false hope.
False hope. It's a scandal. How can these doctors say, oh, you need to be on Depixent the rest of your life? Oh, you need to give it a year before you see any change. Oh, you need cap therapy for 6 months or more. Where do they come up with this? They have no data. They don't have 50 patients or 100. They make it up, and the patients go along with it. How would you like to spend $2,000 for 6 months and get nowhere?
Well, I think I'd probably have to spend $2,500 because I need air conditioning and hot water. That was actually said in the video.
I got to get you to Thailand on an airplane first.
Well, yeah. I hope Abby Walsh doesn't mind me reading her reply to one of these cap therapy comments. Abby Walsh 1470 says, this is brilliant, by the way, can we get our money back if the treatment doesn't work? Because as TSW sufferers, we've spent thousands of dollars on many things that don't work. We've gone down this road or these types of roads numerous times. Are there peer-reviewed studies that show this has worked on TSW sufferers? And what's in the serum? Oh, I forgot to mention that. There's a magical serum that you have to use.
I'm not sure if it's their serum spun down or who knows what. I'm not sure. I don't know.
No, you have to buy this serum. It's in a counter.
Oh, buy their serum.
Yeah, when you go into the place in Thailand, it's a counter and the serum's behind the counter. How do we know there's no steroid in it? Boy, that's an interesting comment. Wouldn't that be the piece de resistance?
Get a little better.
Here's our magical serum that doesn't have the ingredients listed.
We've seen that repeatedly with, I'm sorry to our confreres in China and India, but in packaged goods and medicines from those two countries, often in a foreign language that we do not understand, there's hidden steroids.
Well, that's her last line. Because some creams have steroids in them without declaring it. Doctor, I'm becoming a jerk. I'm becoming an obstreperous, opinionated, obnoxious, closed-minded jerk.
Well, you see why I get so angry. You know, I am reading and listening on the phone and seeing distraught human beings who are suicidal. They're not just, I got a cold and I need an antibiotic. They're despondent. They have been whipped like a sail on a blustery sailboat, back and forth with no quietude in their life. And they're ready to commit suicide. And I listen to them. And I try to reach out and comfort or say, do this or do that. Let me talk to your doctor. I have put my probes out. No, I've touched the probes that have been sent to me thousands of times. I don't know what more to do. But I can say when the advice is wrong or bad by a patient, okay, that's one patient. if he or she goes down that pike and it doesn't work, that's only one. But I'm fearful that 200 will read his or her advice and will follow the same advice.
Well, and follow the same advice, have it not work, and declare the whole thing a loss and go back on steroids.
Yeah. It's a very interesting entity. You notice that I have put in a huge amount of time because it necessitates that. It necessitates a huge amount of caring. It necessitates for me to have my ears and eyes open at all times, listening for any nuance, anything different, anything that doesn't sound right, and make a move when a move has to be made. But there are times, and I've used this metaphor so often, there are times when you don't have to do anything. And one of my professors in med school said, and I think I've said it here, sometimes the best therapy is a long black cigar.
Yeah.
You don't do anything.
Well, in this case, it's a long black cigar while sitting in the bathtub for 3 years.
Yes. You look like Churchill, who used to take baths. We can laugh because these people will survive. They'll be cured.
Well, not if they go back on steroids because they've lost all hope because they follow these stupid regimens. And you know what? If CAP therapy is so wonderful, why isn't somebody soliciting the NEA to go study it? Send a contingent of sick people to Thailand and sit with them a year and watch them. You know, that's the other thing that drives me batshit. All this good I hear about, that the NEA does. What are they doing?
They are advertising for 8 or 10 companies on their front page, obviously getting stipends from them. They are going to meetings and suggesting and soliciting that what they are advising is that you have eczema all your life, follow our companies that provide drugs, and listen to our advice. But suddenly, within the last 6 months, they're giving lectures about TSW. They're recognizing that the steroids are a problem. Wow. And as you and I have said in the last prior 3 tapings, conversations, there were 3 big blows. Yep. And the first one was the recognition of steroids on TV ads saying, our drug doesn't have steroids in it. Our drug doesn't have steroids in it. Our cream doesn't have steroids in it. Suggesting to the public, see how good we are? We recognize
Well,
it.
yeah, but where are the clinicians and the NEA, by the way, saying, well, wait a minute, why are they saying that the drug doesn't have steroids in it?
Why?
Let's have that conversation. Yeah. Why do they feel that they need to make that disclosure? It's all unsaid. It's all like the secret handshake of knowing how to get well.
Well, I'm not sure if my logic is there, but when they say and not believe in the word addiction and red skin syndrome, and they believe it's bad eczema, and they say we must stop you from suffering and we must put you in TSW, steroid withdrawal. Well, withdrawal, it never is said with the end of steroids. We might have to just get you down to a lower dose. We might have to stop, but you can start it again. We might have to maybe never stop it totally, but you can continue and it'll be safe. It's not safe. They are addicted to steroids. But the implication of withdrawal is that we might not have to take it totally away from you. It's a good drug. We'll continue to use it. That's the feeling I get if you don't show the backup of why I need withdrawal. It's called addiction and red skin syndrome. And they are addicted and they do not have bad eczema.
Yeah, period. I think the reason this is kept quiet is a little bit more insidious. If all of a sudden the American Medical Association and the FDA came out and said that steroid usage is awful, and the continued uses of it creates this condition known as topical steroid addiction, and the only way to get rid of it is to go through topical steroid withdrawal. The class action lawsuits doctor, would be absolutely astronomical. Can you imagine that? If the FDA came out and said steroids, said all the things that you're saying.
Well, let's think about that. And I'm trying to remember the past history of medicine a little bit. And I can quickly, as you were talking, think of a couple examples. You know, arsenic therapy used to be used in psoriasis and derm problems. Arsenic therapy killed. It took a while for it to be taken off the drug lists. Coca-Cola had cocaine in it. It took it a while for it to come out of the drink. There are eye drops that cause blindness. It took a while for them to take it off the market. You know, et cetera, et cetera, et cetera. This is not of that magnitude, but the severity of the lifestyle and the taking away of life is huge.
Right.
And the number of people are huge. And therein lies our annoyance, our anger, and why we're doing what we're doing. And, you know, every once in a while, a patient who's angry gets angry. Where are they going to turn? The doctors who put them in the fix are long gone. They take it out on us. We're bad guys. So they'll argue on a YouTube or a reply that what I said was wrong or whatever.
Well, that's fine. I mean, have someone that you've cured say that you're wrong.
Yeah.
And having said that, I am noticing a large trend of cured, addicted patients post on these threads basically saying you're nuts. You know, you're nuts. God bless you, and go try it. But as Abby said, can we have our money back if it doesn't work?
Yeah, there's some very smart people out there. I'm always impressed that only 1% write replies to anything. They're quiet. They accept what has to be done. So we don't know what else is going on in possibly 60% or more of the patients out there who read our YouTubes. We'd like to hear from them, but I guess we take solace in the numbers. And I'm a little bit crazy about that, and I follow how many views we've had on the movie, on all of the conversations and the tapings that we've done, and every week they increase by 5, by 10, by 50. The new ones increase very rapidly. Most of the initial conversations, 1 through about 15, have 1,000 to 4,000 views.
Yeah.
And you keep saying, relax to me, and I keep saying, you know, we only have 700 from 2 weeks ago. Relax, relax. Sooner or later, more and more.
Well, it's getting reposted. I mean, our work's getting reposted on TikTok.
I'm assuming that they're all different people.
They have to censor my foul language.
It's not the same person. And I'm assuming that they all are suffering. They're not just stray people looking for things to look at night.
No, it's getting reposted.
Yeah.
And let me preemptively thank everybody that's watching for liking and sharing and subscribing to this channel. It really does change the algorithm, and it does help propagate the message. So thank you very much for doing that.
John, as always, you ask the right questions. You come up with the best protocol. We are going to change the world, damn it, the world of bad eczema.
Well, we'll keep going and just keep trying to get the message out and break through the noise of leaky guts and gluten and acupuncture.
Cap therapy.
Yeah, cap therapy. Well, you know, this is going to create some comments, and anybody that's had success with cap therapy, please present yourself to the NEA and ITSAN and let them spend some money on validating the claim.
Okay, but the final comment on my part, being Mr. and Mrs. Patient, be scientific. Everything in medicine is based upon one change, one drug, one therapy. If you do 2 things, it could be one or the other that are solving the problem. when you stop steroids and you go on cap therapy, why are you giving credit to cap therapy?
Right.
It's the cessation of the steroids. Why are you, et cetera, et cetera, et cetera.
It's the guy beating the drum in Central Park.
Yeah.
Why are you beating the drum? Well, it keeps the giraffes away.
Yeah.
You don't see any giraffes, do you?
The giraffes, they're all gone.
They're gone. All right. We can't lose our sense of humor.
I'm sorry?
We cannot lose our sense of humor.
Well, you're a good foil for me. I get angry very quickly.
Oh, today I'm the one. All right. Thank you, Dr. Rapaport. Until the next time, please like, share, subscribe.